ask you, is there any other aspect of healthcare that you deal in where you can't refer properly? So you've already outlined that you don't have to look at the Constitution, any other aspect. And I suppose what I'm thinking here, I know you did one particular case study in your presentation, but I'm just thinking about perhaps a woman who may be fit and healthy, but she might have a clotting disorder, for instance. And therefore, obviously, a relatively simple, safe procedure as a medically induced abortion or surgical abortion in the early stages would obviously then have an added level of complexity to it. And maybe just teasing that out as medical people yourselves, so how the barrier of you not being able to refer and sending a woman off with a photocopied chart under her arm that could be left on the plane. I'm just putting that out there. Or maybe in the stress of the situation, they may not. We all often go into the doctor with something in our mind that's wrong with us and completely forget when we, the way, the process of teasing out information, that the information may not be disseminated properly to the practitioner abroad for whatever variety of reasons. I suppose I'm also thinking about, I'm not referring to suicide, but I'm talking about people with particular mental health needs. And I suppose as medical people, somebody on complex drugs for schizophrenia or borderline personality disorders. And I suppose as a doctor, as doctors, how do you feel sending somebody off in those circumstances on their own on a plane or on a boat, and the challenges that must be for ye professionally, just if you could tease some of those out. Also, I suppose certain women with reduced immunity due to maybe autoimmune diseases or on steroids, and also the added I suppose risk of infections.
Questions,
yes,
and
please.
if you have time, then I will have some answers.
Deputy Connell, presumably because you've got a strong healthcare professional background yourself, you totally know all the buttons to press on our side. It is unique, and one is nearly tempted to go back to that other famous parliamentarian, grotesque, unbizarre and unprecedented, etc. There is no other situation in healthcare where we're not allowed actually to make a referral. When you consider the average patient, whoever that is, who might be a 32-year-old fit, healthy adult woman, arguably maybe the risk is actually quite low and the level of complexity is low. But we all know in practice that in actual fact unusual situations are actually quite common, really, given the complexity. And you've outlined them all, you've answered the question. It adds enormously to the uncertainty in these circumstances. These are the cases that keep us awake at night. These are the cases that we do feel vulnerable about. These are the cases where criminalisation looms large in the consultation for the practitioner. It is ironic in 2017 that the Irish state is now finally rolling out electronic referrals to a whole range of services in the public system eventually, but that we're not actually able to make a paper referral for this particular service. So we are in a very difficult situation as matters stand in relation to the 8th Amendment in primary care.
Thank you. You have more time. Yeah.
I suppose I'm assuming all of this in light of your previous comments, the protection of life during pregnancy, the presence of the 8th Amendment, and all of these issues that I've just discussed with you, all of these, could I sum up as saying, are bad for women's health in Ireland? Could we be so clear
Yes.
as to say that?
Yes.
Thank you.
Thank you. Thank you, Jeff.